All right, welcome. Today, we are diving deep into multiple sclerosis, and we're going to do it through a very specific lens, sharpening your patient counseling skills.
Okay, so here's our game plan. We're going to kick things off with the basics, what MS actually is, then we'll walk through the disease course, get into the nitty-gritty of the therapies, and cover some really critical risks. And we'll wrap it all up with some key takeaways you can literally use in your pharmacy tomorrow.
All right, first things first. Before we can counsel anyone effectively, we have to be on solid ground, so let's really lock in our understanding of what this disease is all about.
So, at its very heart, MS is an autoimmune disease. What does that mean? Well, think of it like this. The body's security system gets its wires crossed and starts attacking its own stuff. In this case, it goes after the myelin sheath. That's the protective coating around nerve fibers in the brain and spinal cord. When that insulation gets damaged, the electrical signals just can't get through properly, and that's what causes this huge, unpredictable range of neurological problems.
Now, this is a big deal, especially if you're practicing in Canada. It has one of the highest rates of MS in the entire world. So this isn't some rare disease you might see once in a blue moon. No, this is a condition you are absolutely going to encounter probably pretty often. So when a patient comes to you and says they have MS, this is what they might be living with day in and day out. And all of these things, the numbness, the crushing fatigue, the brain fog, the vision issues, every single one of them traces right back to that short-circuiting of nerve signals we just talked about. You can see how this profoundly impacts someone's quality of life.
Okay, let's build on that foundation. We're moving into the disease course now, which is basically the patient's journey with MS. And trust me, understanding which type of MS your patient has, well, that's absolutely critical. It gives you all the context you need for your counseling.
This table lays it all out for us, the four main flavors of MS, if you will. But look at that number for RRMS, 85 to 90%. That's the one you're going to see most often. It stands for relapsing remitting MS, where patients have flare-ups or relapses followed by periods where things are stable. It's also super important to know that a lot of these folks will eventually transition into what's called secondary progressive MS down the road.
All right, now we're getting to the heart of it, the therapies, the disease-modifying therapies, or DMTs. This is really where you, as the pharmacist, become an absolutely vital part of the patient's care team.
Okay, so when it comes to treatment strategy, there are basically two main schools of thought. On one hand, you have the traditional approach. Start with a safer first-line drug, and then escalate to something stronger if needed. On the other hand, there's a more aggressive strategy. Hit it hard from the get-go with a high-efficacy therapy, especially for patients whose disease is really active. As you can imagine, your counseling is going to look a little different depending on which path they're on. And this right here, this is huge. The therapeutic window. Basically, time is of the essence. Getting a patient started on a DMT within the first 5 years can dramatically change their long-term outcome. It can delay disability. This is why your role in helping them stick with their therapy right from the very beginning, it's not just important, it's a game changer for their entire life with this disease.
So for these first-line drugs, your counseling can literally make or break whether a patient sticks with their treatment. For interferons, you got to prep them for those flu-like symptoms. For glatiramer acetate, a heads up about potential skin denting is key. But for teriflunomide, this is a non-negotiable, red alert conversation. You have to be crystal clear. It's absolutely contraindicated in pregnancy. Period.
Now, when we step up to these second-line therapies, the stakes get higher and so do our counseling priorities. The conversation has to shift. With natalizumab, we're talking about a serious risk of PML. With ocrelizumab, it's about managing infusion reactions. And with the S1P modulators like fingolimod, you've got this double whammy. You need cardiac monitoring for the first dose, and you have to warn them about a severe rebound if they stop it suddenly.
Okay, let's zoom in on two really critical risks that you're going to be helping patients manage. We just mentioned it, but let's talk more about PML, and then we'll get into the importance of vaccinations, which is huge.
So you've seen this warning, PML. Progressive multifocal leukoencephalopathy. It pops up on a few of these DMTs. But what is it exactly? And why is it such a big deal in the world of MS treatment?
Okay, so PML is a brain infection. It's rare, but it can be fatal. It's caused by the JC virus, which, believe it or not, most of us are walking around with. It's usually dormant, but these powerful immune drugs can let it wake up. This table really shows you why drug choice is always a risk-benefit game. You see natalizumab at the top with the highest risk. That's why patients on it need super strict monitoring.
This is where you can be so incredibly proactive. Before a patient even picks up that first prescription for a DMT, you should be asking about their vaccines. The big takeaway is vaccinate before they start the immune-suppressing drug if you can. And once they're on most of these therapies, live vaccines are an absolute no-go. You're the gatekeeper for that information.
All right, let's shift gears to a topic that is probably one of the most common and most sensitive you'll discuss, especially because MS hits so many women during their childbearing years. We're talking about family planning, pregnancy, and breastfeeding. Having a clear framework for this conversation is just essential. And step one is everything. Plan ahead. This discussion needs to happen before a DMT is even chosen. Why? Because if a patient is thinking about starting a family soon, you'd want to avoid drugs like fingolimod, which has that nasty rebound risk if you stop it for a pregnancy. And what about breastfeeding? Well, the default advice is usually to pause the DMT, just to be safe for the baby. But, and this is a big but, it's not always that simple. If the mom's MS is really active, stopping treatment might not be an option. The good news is we do have some safer choices like glatiramer acetate and the interferons that can be considered. Okay, we've covered a ton of ground, so let's boil it all down. What are the absolute must-know essential tips you can take away from this and apply right now with your next MS patient? I love this quote because it really gets at the strategic thinking you need. It's not just about dispense and forget. It's about thinking long-term. Why are we choosing this drug for this patient at this point in their life? You're tailoring the therapy not just to their disease, but to their life plans. And remember, your power as a counselor goes way beyond just the drugs themselves. These lifestyle points are huge. Recommending vitamin D, simple but important. Stressing the management of things like depression, crucial. And really leaning in on smoking cessation, you could literally be helping to slow down their disease progression. That's a massive impact. Okay, if you remember nothing else, please burn this into your brain. For fingolimod and natalizumab, stopping suddenly is not an option. It's not just about losing the drug's benefit. It's about risking a severe, and I mean severe, rebound of their MS. This is a message that has to be delivered clearly and probably more than once. So there you have it. We've walked through a structured way to think about MS counseling, from the science to the therapies to the very human side of it all. The question now is, how are you going to take these insights and weave them into your next conversation with a patient? Because that's where this information really comes to life, empowering them and truly elevating their care.